Canine parvovirus, otherwise known as parvo, is a common infectious gastrointestinal illness in puppies and young dogs, and is deadly without treatment. It first emerged in 1978 when a virus similar to feline panleukopenia crossed over from cats to dogs and created a new type of disease among domestic dogs. It can survive indoors at room temperature for at least 2 months and is resistant to many commonly used cleaners and disinfectants. It is transmitted through direct contact through the nose and mouth with infected feces, or indirect contact such as clothing, equipment, human skin, or the environment. An infected dog can spread the virus 4 to 5 days after exposure, often before the dog shows symptoms of exposure. It is highly contagious. Immediate veterinary attention and isolated intensive care is needed for treatment. The vet will administer supportive fluids, nutrition, and medications because parvo lowers white blood cell count. Antibiotics will also be used to prevent bacteria from entering the dog through the damaged intestinal walls. Most puppies that survive the first 3 to 4 days will make a complete recovery. Parvo is prevented in a series of vaccinations when the puppy is between 6 to 8 weeks old, 10 to 12 weeks old, and 14 to 16 weeks old. A booster shot is administered 1 year later and every 3 years after that. Possibly exposed dogs should be quarantined and checked before they start to show symptoms. Rabies is an uncommon, incurable virus that attacks the brain and spinal cord. It has been known since around 2000 BC. In 1804, George Gottfried Zenke first transmitted rabies 1 from a rabid dog to a normal one, and from a dog to a rabbit and a hen, by injection of saliva. This proved that the disease was infectious. Rabies is transmitted through saliva and is often passed through a bite wound from an infected animal. It can also be transmitted from an open wound that is exposed to the saliva of an infected animal, usually through licking. It most frequently comes from exposure to wild animals like bats, raccoons, and foxes. Rabies can be diagnosed by a blood test, but to be 100% accurate, testing requires a biopsy of brain tissue, so it can't be completed until an animal has died. Once the symptoms start to appear, there is no way to treat rabies in dogs. If a veterinarian suspects rabies, your dog may be euthanized since they could spread the virus. The rabies vaccination is 100% effective, and in most states it is required by law. All dogs should be vaccinated for rabies around 14 weeks old, and then again at 1 year old. Depending on local regulations, revaccination should happen every 1 to 3 years. Avoiding wild animals can help, but vaccination is required.